Good morning, Doc Avril.
Yes, ma'am. Good morning. So, can you tell me about your son's case?
Well, I cannot really tell you what really happened, Doc, since I was in home when my son felt the sudden numbness, but there is his brother, so he can tell you everything.
Hello, Doc. The left part of my brother's face suddenly paralyzed while we were praying. He said to me that the left part of his face suddenly became numb.
Okay, Mr. James, can you state your full name and your age and where you live?
Um, my name is James Aaron Ramos, and I am currently 18 years old, and I live in Parang, Marikina City.
As I can see, you have drooping of one eyelid and some changes in your facial expression. So, are you having trouble when you eat or when chewing and swallowing?
Yes, ma'am.
As I can see, you have drooping of one eyelid and some changes in facial expression on one side of your face, and you experience difficulty in swallowing and chewing. So overall, from these statements, I could tell that you have MG, but to confirm that we have to do proper tests or examinations such as physical or neurological examination. Well, to confirm this diagnosis, we have something called ice pack test. It's for your eyelid drooping, and I will place a bag filled with ice on your eyelid. So after 2 minutes, you will remove the bag and analyze your droopy eyelid for signs of improvement. Okay?
Okay, Doc.
There's no improvement.
So if there is no improvement, let's proceed to the blood test. So the blood test is needed to reveal the presence of abnormal antibodies, which disrupts the receptor sites where nerve impulses signal your muscles to move. As I can see from your previous medical records, you also have type 1 diabetes. So this diabetes and MG, which is the myasthenia gravis, are both autoimmune diseases, which is really possible that is linked why you had MG. And also from the blood test, the result you have is you have a high level of these abnormal antibodies, which means you have myasthenia gravis. In myasthenia gravis, antibodies block, alter, or destroy the receptors of acetylcholine, which prevents the muscle from contracting.
Is there any medication available for my brother, Doc?
There is no cure, but there are treatment options. It could be medication, supplemental therapy, or may undergo surgical thymectomy, which is surgical removal of the thymus gland. This surgery reduces MG symptoms and may cure some people, possibly by rebalancing the immune system. This improvement, however, is unpredictable and may take several months or several years after surgery to occur. So you must choose from these options. I would like to say that thanks for going here as early. That's why we already detected the disease before it got worsened. Good morning, ma'am. I think you have already decided.
Yes, Doc, we decided not to undergo any surgery as we discussed and decided to just undergo physical therapy.
Okay, so the nurses will present some things for you. I already assessed them what they have to say as a pointer for you. So when you visit the hospital, from your previous medical records, there is no medicine that may trigger MG. So I already said to the nurses everything that they need to do. So let's see each other in our next checkup, which will be 2 weeks from now, okay?
Okay, Doc, thank you. And please take care of my son. Thank you.
Hi, we're expecting your arrival today, Mr. James. Doc A told me that before you undergo physical therapy, you need to drink these medications, pyridostigmine or mestinon. These drugs prevent ACH destruction and increase the accumulation of ACH at neuromuscular junctions, thus improving the ability of the muscle to contract.
What will this drug do to my brother, ma'am?
The benefits of pyridostigmine occur within 30 to 60 minutes. Tablets should be taken at regular intervals throughout the day. Side effects include excessive salivation, involuntary muscle twitching, abdominal pain, nausea, and diarrhea. I also added other drugs may use it with anticholinesterase medication to reduce gastrointestinal side effects. So, for the medication, doctor decided for you to have this medicine and not a combination of other medicines for MG. Do you have any questions regarding this medicine?
None, ma'am.
Okay, we will be directing you to the examination room and get some blood samples.
Hi, sir. I'm here to explain how to reduce the numbness of your facial muscle. Mr. James, these are the things Doc Ev said you needed to do. You need to eat healthy and maintain healthy weight because extra pounds make it even more fatigue to get around and aggravate a host of other diseases. You need to manage stress. You may have massage therapy or more because stress is one of the things that triggers NG. You may do some meditation. Getting adequate rest every day and minimizing physical exertion, tiredness, and exhaustion so getting plenty of rest and not overexerting yourself may help.
Noted, ma'am.
Okay, if you have some concerns, contact Dr. Abe first, and here is your weekly physical therapy sessions with Dr. Abe. And we hope you'll get better soon.
Thanks, man.
Thanks, ma'am.
The name myasthenia gravis, which is Latin and Greek in origin, means grave or serious muscle weakness. MG is also a chronic autoimmune neuromuscular disorder characterized by fluctuating weakness of the voluntary muscle groups. MG is not transmitted via intimate or any form of contact, but we need to keep in mind that MG can happen to all no matter what your age, race, or gender. There is no known cure in myasthenia gravis, but with current therapies, most cases of myasthenia gravis are not as grave as the name implies. Available treatments can control symptoms and often allow people to have a relatively high quality of life. Most individuals with the condition have a normal life expectancy.
And that's it again for our group video presentation. Thank you for watching and see you again in our next video. Thank you for watching.